Hey, welcome back to my channel. It's Doc Junel, and this is the third installment of our skeletal system lecture. In the first video, we talked about bone physiology. In the second video, we discussed the eggshell skeleton. And for this video, we'll be talking about the appendicular skeleton. Mind you that the eggshell skeleton only has 80 bones, but in the appendicular skeleton, we will be talking about 126 bones in total. So first, we're going to be talking about the girdles. As mentioned, the girdle is the one that attaches the limb to the body, and there are two girdles. The pectoral girdle or the shoulder girdle and the pelvic girdle or the hip girdle. So the pectoral girdle is composed of two bones. The scapula, which is this one, it is also known as the shoulder blade, and the clavicle, this one, which is the collarbone. So we have one clavicle and one scapula on the left and one clavicle and one scapula to the right. So it is to the scapula and the clavicle that we are able to attach the upper limb to the rest of the body. So the collarbone is attached to the manubrium of your sternum. Okay, it is attached to the manubrium of the sternum, and there is a sternal end, the one that is attached to the sternum or the manubrium, and we have the acromial end, which is attached to the acromion process of the scapula, which later on I will show you. So here is the acromion process. This is where the acromion process of the scapula. This is where the clavicle would attach to. All right. So here we have the anterior view, and this is the posterior view. So we also have the glenoid cavity, also known as the glenoid fossa, and it is here that the upper limb would attach to. So this cavity is where the head of the humerus would actually attach to. All right. So again, we have the acromion process. This is where the clavicle would attach to. At the back, we have the scapular spine. We have the glenoid cavity or glenoid fossa. And we also have other pictures of the acromion process here. The scapular spine and the coracoid process. Again, when you see the word process, it means protrusion. Now, let's talk about the upper limb bones. The upper portion of the limb is called the humerus. Humerus. Okay? And as you can see, the head of the humerus inserts into the glenoid fossa or the glenoid cavity of your scapula. Okay? In the forearm, we have two bones, the ulna and the radius. So the ulna is more medial, while the radius is more lateral. We also have this series of small bones, which are your carpal bones. We have the metacarpals, and we have the phalanges, which are the finger bones. So this position here is in anatomic position. So kindly remember that the radius and the thumb are always on the same side. Okay, so radius is lateral because the thumb is also lateral in anatomic position. So humerus, ulna, radius, carpals, metacarpals, and then phalanges. So first, let's talk about the humerus. So of course, we have the head of the humerus, and again, it inserts into the glenoid fossa. We also have the anatomic neck of the humerus, meaning this is where the head separates from the diaphysis. We also have a tubercle. Again, when you see the word tubercle or tuberosity, it is a lump of bone. So this lump over here is the greater tubercle, and this lump over here is the lesser tubercle. We call this the surgical neck because usually this is where fractures would happen. And then this lump over here is called the deltoid tuberosity. Deltoid because there is a muscle in the shoulder called deltoid, and this is where it inserts or attaches. At the inferior portion of the humerus, we have several parts as well. We have the epicondyles, which are smooth rounded parts of the bone, so lateral and medial epicondyle. And we have also the condyles, which are the capitulum and the trochlear condyle. These condyles will attach to the radius and the ulna in the forearm. Okay? So, unfortunately, you do have to memorize these different parts of the humerus. So, again, this is your humerus. We can see here the greater tubercle. Itong lump na ito, this is the greater tubercle. You see this small lump, this is the lesser tubercle. This part of insertion, this better seen here, this is the deltoid tuberosity, this depression here. Then we have the medial epicondyle, the lateral epicondyle, and then the condyles, the trochlear and capitulum. Yan. So the head of the humerus, the anatomical neck, the surgical neck, the tubercles, the greater and the lesser tubercle as pointed out earlier. And in between the greater and lesser tubercle, we have the intertubercular groove, the deltoid tuberosity, which is usually that depression on the sides. And then the median epicondyle and the lateral epicondyle on the other side. The capitulum is usually lateral and the trochlear condyle is more medial. Okay, capitulum and trochlear. Yan. Here we can see them better. Median epicondyle inward. So if you touch actually your arm, you would feel your median epicondyle. It's a protrusion on the sides. And then the trochlea. And then we have a depression here called the coronoid fossa. And the other condyle is the capitulum. This is where the radius and ulna would attach to. Now we have the radius and the ulna. Again, the more lateral is the radius and the more medial is the ulna. So in this image, this is the radius, the shorter one, and the longer one is the ulna. Ayan. So let's talk about the radius first. The radius has a head. It seems flat, and usually this is the one that attaches to your trochlea, to your capitulum rather. So you see the flat head of the radius here. It attaches to the capitulum. And then we have the radial tuberosity here. It's a lump of bone here on the radius. You have the shaft or the body. And then at the very end, you have what we call a styloid process. Remember, we also have a styloid process in the skull. So, meron din siya sa radius and ulna. Meron siya sa radius. We also have that in the ulna. And then, we have here the head of the ulna at the bottom. Okay? The shaft of the ulna. And then, we have this protrusion here. We call it the coronoid process. And that coronoid process would enter the coronoid fossa. Yan. And then, we have the olecranon process. Itong olecranon process is very important because it will attach to your trochlea. Yan. It would attach to your trochlear condyle. So, radius is the shorter one. Now, this is anterior view. This is posterior view. Yan. So, usually, radius and thumb are on the same side. Please do remember that. And then the one in the middle will also label that. This is the head of the radius. The radial tuberosity, that lump of bone. We have the styloid process of the radius at the end. So it attaches to the carpals. Yun yung function niya. Nag-a-attach siya sa carpals. You also have the ulna. Diba? It is usually along the pinky finger. Yan. And then we have the olecranon process. Yan, si olecranon process. It will enter the trochlea, as mentioned. Trochlea, or the semilunar notch. Then the coronoid process would enter the coronoid fossa. It also has a styloid process at the very end. And we have the head of the ulna at the bottom. And then, that middle portion which connects your radius and ulna, we call that the radio-ulnar joint. Also, your carpals, we have 8 bones in the carpals. Okay? So, 8 bones. In the proximal row, sabihin yung pinakataas, there are 4 bones. Your scaphoid, lunate, triquetrum, and pisiform. And then at the bottom, another 4 sets of bones, hamate, capitate, trapezoid, and trapezium. So, yep, you have to memorize those. We have 5 metacarpal bones. 1 will start on the thumb. 1, 2, 3, 4, 5. And then the phalanges. Okay? So, may proximal phalanx. 1, 2, 3, 4, 5. We also have distal phalanx. Sa thumb, distal na agad. But in the other fingers, you also have the middle phalanx. That's why 14 lang yan. Kasi 1, 2, 3, 4, 5. And then yung middle, 4 lang. 1, 2, 3, 4. Then yung distal 5 ulit. 1, 2, 3, 4, 5. Okay? Those are the bones of the wrists and the hands. So sa carpals, yan sila. Then you also have to memorize later on yun sa tarsals, ankles. Alright, let's now go to the pelvic girdle. So the pelvic girdle is the one that attaches the lower limb to the body. So it's composed of your hips. So ang pelvis natin, the pelvis is actually, the pelvic girdle is actually composed of 3 bones put together. Okay? These are the pelvis, which is this part over here, the ischium here, and the pubis. The ischium and the ilium rather. And then sa pelvic girdle natin, it also has a cavity and you call that the acetabulum. This is where the femur would insert. The acetabulum would be where the femur would insert. So please do remember, glenoid fossa sa upper limb, acetabulum sa lower limb. So again, here are your hip bones. So nakakonect siya sa sacrum mo. Ba? Your ilium, your ischium. Yeah. Again, ilium is the one in green, ischium is the one in orange, and pubis is the one in blue. One on the left, one on the right. Now, through the formation of the pelvic girdle, we are able to identify yung mga skeleton if it's from a male or a female. Usually, the pelvic inlet or that hole formed by your pelvis is different between males and females. So in males, it's more pointed at the front. No more parang triangular in shape. But in females, it's more circular. And this circular formation allows the passage of babies through the pelvis. Yan, okay? Kaya very important yan. Dapat in females, it should allow the passage of babies in childbirth. Also, if you will notice yung daanan, it's very narrow for males, but for females, it's very it's much larger. So we call that hole the pubic inlet. Okay, the pubic inlet, we use that to differentiate between males and females. And the one that attaches the pubis to each other, we call it pubic symphysis. Pubic symphysis. Now, when it comes to your leg bones, we have the femur or the thigh bone. Please do remember the femur is the longest bone of the body. The femur is the longest bone of the body. We also have the patella or the kneecap, the tibia and the fibula, which is for the lower leg. And later on, we'll discuss the tarsals and the phalanges. So the tarsals are the ankles, the metatarsals for the foot, and the phalanges are for the toes and fingers. So first, let's discuss the thigh. Of course, just like your humerus, it has a head. And then this large extension or parang neck area, we call it the neck of the femur. And then this lump of bone on top, we call it the greater trochanter. And then at the bottom, we have the lesser trochanter, the body of the femur, and the part where there is a long line, you call it the linea aspera. Here, this long line, the linea aspera. We also have the lateral and medial epicondyles and the condyles itself, where it connects with the tibia and fibula. Yeah. Also here we have the patella or the kneecap. So the head of the femur, the neck of the femur, the greater, these are the ones on top, and then the lesser trochanters are the one at the bottom. The linea aspera is that long line. The gluteal tuberosity is where the gluteus maximus or the butt muscles would attach to. The shaft or the body of the femur. The medial condyle and the lateral condyle. Also, the patella has several parts. So we have the patella, the bottom or pointed part, we call it the apex. The flat part is called the base. And then the outer surface or the part of the patella which attaches to both bones, we call it the articular surface. In the leg, we have the tibia and fibula. So the tibia is the larger one and the fibula is the smaller one. Please do remember that the fibula is always lateral while the tibia is always medial. So the tibia also has a medial and lateral condyle that attaches to the medial and lateral condyle of the femur. And then we also have the malleolus. So the malleolus is ang counterpart nito sa upper limb is your styloid process. Diba? Remember, sa radius and ulna may styloid process. But in the tibia and fibula, we call it the medial malleolus and the lateral malleolus. Yeah. So we have the tibia here, the lateral condyle, the medial condyles. We have the medial malleolus, the shaft, and if may linea aspera, yung tibia meron ding anterior crest. The fibula is always lateral, as you can see here. The head of the fibula is on top, the shaft, and then the lateral malleolus, which attaches to your ankles. Yeah. When it comes to the foot, you have your ankle bones, which is your calcaneus, your talus, cuboid, navicular, then your cuneiforms, which is medial, intermediate, and lateral cuneiform. Those are your tarsal bones. Itong 1, 2, 3, 4, 5, 6, 7. 7 tarsal bones. Calcaneus, talus, cuboid, navicular, medial, intermediate, and lateral cuneiform. We also have 5 metatarsal bones. And then similar to the hands, we have proximal, middle, and distal phalanx. And then of course, sa big toe, wala siyang middle. Meron lang siyang proximal and distal phalanx. Okay. So this is your talus, calcaneus. This is superior, this is inferior view. Cuboid, your navicular, and then your medial, intermediate, and lateral cuneiforms. Those are the 7 tarsal bones. Now, let's talk about the meeting point of these different bones. So again, we call them articulations or joints. This is where two bones come together. Joints can be classified into two. First, by structure, and second, by function. So when we say joints are classified by structure, we want to determine what type of connective tissue joins the bones together, and if there is a fluid-filled capsule present in between those two bones. But in functional categories, we are talking about the degree of motion, if movable ba or hindi movable yung connection between two bones. So first, by structural classification. So here again, by structure, we are talking about what type of connective tissue connects the bones. First, we have fibrous joints. When we say fibrous joints, they are joined together by a fibrous connective tissue. And examples include your sutures. Remember, in the skull, we have sutures. Examples include your gomphoses. I think this will be discussed in the laboratory. And your syndesmosis. Another type of joint are cartilaginous joints. They are connected by cartilage, thus the name cartilaginous. You will find this in the symphysis. Remember your pubis symphysis. In your synchondrosis. This will be discussed in the laboratory. And then we also have synovial joints. Itong synovial joints, these are joints that have fluid cavity. And usually you will find them in the appendicular skeleton, like in between the knees. Usually yan, or in the elbows, we have synovial joints there. By functional classification, again, ang basis nito is the movement. So we call joints as synarthrosis when they are non-movable, meaning the connection between two bones does not allow them to move. Just like the bones in the skull, diba? We mentioned repeatedly that the bones in the skull cannot be rearranged, cannot move on top of each other. So these are non-movable and they are called synarthrosis. There are also bones in the body which are, when connected, allow slight movement. And we call them amphiarthrosis. And usually you find them in between the vertebrae. Okay, in between the vertebrae. Then lastly, we have freely movable joints called diarthrosis. So usually you see them in our wrists, in our elbows, in our knees, and even in our shoulders and hips. Diba? Freely movable. Also, we've already mentioned this, the sutures and fontanelles. So sutures are the connection between two bones, especially in the skull, and fontanelles are the holes formed by the non-union. So like this one, the frontal bones and the parietal bones have not yet joined together. So it forms a hole in the middle, a diagonal hole or diamond-shaped hole, and you call that a fontanelle. So we have two, the frontal fontanelle and the occipital fontanelle. So let's just highlight synovial joints. Again, synovial joints are joints filled with fluid. And this cavity or joint cavity is created by a joint capsule. So the joint capsule holds the bones together, but it still allows for movement. And the joint capsule is usually composed of two layers, an outer fibrous capsule and an inner synovial membrane. Let me show you. Yan. So here is the connection of two bones, and you have here a joint capsule. So the two layers are the fibrous one, the outer one, Yan. And then the middle, the inner layer is called the synovial. The synovial membrane, which is the one in blue. Yan. So outer and then inner membrane. And then inside, it forms a cavity. And this cavity is filled with fluid called synovial fluid. Okay? Also, we see the articular cartilage between the two bones. No? Yeah. So, the fibrous capsule is the outer layer. It is made up of dense, irregular connective tissue. And it is continuous with the periosteum of the bone. So, if you can see here, from being the fibrous joint capsule, it continuous as the periosteum of the bone. Okay? Yan. While the synovial membrane is the inner layer, and it lines the joint cavity which produces synovial fluid, and it acts as a lubricating liquid between the joint. So, yun yung nagpapadulas ng movement. There are other types of synovial joints classified according to their appearance. So, may tinatawag na plain joint, saddle joint, hinge joint, pivot, ball and socket, and ellipsoid. So, this I will leave to you, and it's written in the book naman. Kindly read and determine what joints are classified under them. Lastly, we have different types of movement according to the muscle contraction. So, when we bend, we call it flexion. So, like when you bend your arm, yan, flex, di ba? Finiflex. When you straighten it, you call it extension. When you move away from the midline, you call it abduction. When you move towards the midline, you call it adduction. When you move your forearm with the palms are facing down, you call it pronation. When the palms are up, you call it supination. And when you move a structure about the long axis, you call it rotation. So, this is flexion, the bending of the forearm. Diba? When you straighten it, you call it extension. When you bend the head downwards, it's called flexion. When you straighten it or move it towards the back, you call it extension. When you move structures away from the midline, you call it abduction. When you return them to the midline, you call it adduction. Palms facing down is pronation. Palms facing up is supination. And then this is your circumduction. Or, yan, circumduction. Now, what is the effect of aging on the skeletal system? Number one, magdi-decrease yung collagen. So, collagen is an important aspect of the extracellular matrix. So, when we lose collagen, the bones will become less flexible. The bones will also lose their firmness. They will lose their bone density, and there will be degenerative changes. Niminipis yung bone, lumiliit yung bone, ganyan. That's why people who are originally like 6'2", when they age, bumababa yung height nila. And that's it. Hopefully, I encourage you to watch through the videos again, read your textbook, and memorize each and every bone. Thank you guys. God bless.